Don Carpenter on News Talk 1270 KIML.
News Talk 1270 KIML. Don Carpenter Show. And welcome back to the program. It's 8:08. And I'm pleased to be joined in studio by Veronica Taylor from Campbell County Health and Della Amond from Campbell County Public Health. And Veronica is an infection preventionist. Is that the proper term to use, I guess?
Yes, it is.
Okay. And of course, Della, you're the director of public health here in Campbell County. So we're going to talk a little bit about Ebola. Of course, it's been all over the news. I mean, I'm sure everyone has heard a million different things about Ebola and how it spreads, and all kinds of stories about how it got here and all that kind of stuff. And we're going to try to answer all of those questions, and we'll also leave the lines open if you have any questions about some of the stuff that we talk about as well. So I guess the first question, now we all know that Ebola is spread by a virus. Is it a virus that's similar to a flu virus or something like that? Or, I mean, I don't know who would be the best to explain exactly what Ebola is and how people get it.
Well, it is a virus, but it's not spread by droplet infection the way cold and flu is. So you get it by coming into contact with someone who is ill, and it's spread by contact with body fluids. So this would be vomit, urine, feces, where you would get it into your mouth or eyes or into a sore in your hand. So it can be prevented by not coming into contact with these body fluids. Right.
So it's not a virus that can live on its own. Like so for instance, a flu virus can live on a doorknob for a certain amount of time. I forget exactly how long it is. It's not a virus that can live on its own for very long, right?
They're not sure.
They're not
exactly.
sure? Okay.
Yes. Right. So the best thing to do is wash your hands frequently, soap and water. If you are not in direct contact with an ill person, if you are, there's some more precautions that should be taken. And of course, cleaning with bleach, if that's what you have available, bleach and water, or what we call a virucidal cleaning solution, which all medical facilities have. Okay, so
the majority of people that have gotten the Ebola virus so far, of course, have come from countries that have large Ebola outbreaks. I mean, now obviously we don't really have a huge sanitation problem in this country, but a lot of third world countries have sanitation problems. I mean, is Ebola a disease that is mainly a sanitation issue?
Actually, it came from, they think, bats, and those bats then infected monkeys, and those monkeys infected humans. So that's really how they think it got started.
Transferred from animals to people?
Yes. And actually, they believe the first cases were in 1976. So it has been around. It's just that we've had several large outbreaks in West Africa this year.
Well, now you mentioned that it transferred from monkeys to humans. I mean, is that a case of bushmeat where they're eating the monkeys and then
yes.
and then coming in contact with the blood while they're preparing the food?
Right.
Okay.
Right. Or eating raw food.
So,
right.
So this is something, again. It's it's obviously a cultural thing. We don't need a whole lot of monkeys here, but it's so this is something that despite what we're hearing on TV, if proper precautions are taken, it's not really no reason to panic.
I would say that if people are educated, if providers know to ask the right questions, and then healthcare professionals will use the proper precautions, protective equipment, that we should be able to handle any cases that come to Wyoming. It's the panic piece is fear, because we really haven't had a case in our area and ever taken care of one.
Well, and then of course, then you also see. I mean, I think most of us our exposure to a highly infectious and dangerous diseases comes from movies. I mean, let's be honest. I mean, everyone's seen Outbreak, and when they think Ebola, that's what they think. Even though that wasn't really Ebola in the movie, they called it something else. But that's really our experience with it. I mean, we're not trained medical professionals, so we don't know a whole lot about it. And you see a guy in Dallas gets it and dies from it, you start worrying. But it is something that can be, I guess, contained if you know what you're doing and you know how to spot someone that's infected.
Yes, I would say so.
Okay, so once someone is exposed to the virus, and there's a latency period, obviously it's variable. I mean, what kind of symptoms would someone that is exposed to it start exhibiting?
Well, they would have a fever of 101.5 or greater, severe headache, muscle pain, weakness, diarrhea, vomiting, abdominal pain, and maybe some bleeding or bruising for no reason. So they're pretty sick, and they aren't really contagious until they are pretty sick. So they probably would be seeking medical care by the time they were sick enough to be contagious. So as a public health department, once someone was into care and presumed maybe to have Ebola, we would make contact with all of their contacts going back from the time frame. The incubation period is 2 to 21 days. 8 to 16 is the average time that somebody else might show symptoms from being in contact with that person. So we would ask these people to monitor their fevers and perhaps stay. There's a CDC chart that tells you, depending on their risk of exposure and what kind of exposure, what they should do as far as staying home, or if they don't need to, but they still need to monitor their temperature. And we would give them that information. We would also be contacting them by telephone every day to ask them what their temperature is, are they showing any signs of these illnesses, and if there's anyone in their contacts that is showing any signs.
So and of course that's the role of the public health department in all of this. I mean, we've heard the stories in Dallas where you hear 100 people are under observation. So they're not under quarantine.
No.
It's just these 100 people. The public health department is calling them every day and saying, have you shown any symptoms? I mean, have you taken your temperature? That kind of stuff.
Right, and we would do that for 21 days.
And now, once if someone has been in direct contact with someone that is already showing symptoms, say, the guy in Dallas, he ran in. It's believed that he contracted the virus by helping a woman back in Liberia get into a cab, and she was ill. I mean, it's pretty tough to see. It's pretty tough to see some of these physical symptoms, but the obvious visual would be the hemorrhaging. I mean, it would be, I guess, would it be bloody nose and bruising and that kind of thing?
Yes, it could be, and they're pretty ill. It's once they are truly infected, they're pretty ill, and it is kind of hard the first few days of past exposure to know, because there are a lot of other illnesses that cause the same type of symptoms. So even your cold and flu can cause a fever, but it doesn't go on to those other kinds of symptoms.
Well, and then that's actually the next quick question I was going to ask. It has to be a combination of a lot of these symptoms. I mean, 101 fevers, fairly common. I mean, that's a pretty serious fever, but it's fairly common. And then, but once you start getting to the, I guess to the stomach ailments and the hemorrhaging, that's when you really, that's the dead giveaway.
And we would hope by that time they would be in
seeking help,
and that the diagnosis would be made by the healthcare professional.
So, and now once, say someone comes to an emergency room with some of these symptoms, I mean, is there a blood test for it, or is it just diagnosed by symptoms, or?
There actually are blood tests. However, you don't get that immediately.
Right.
So the provider's going to have to go by symptoms initially, and also by, Della mentioned, the risk of exposure. That's the piece that the provider's going to have to look at. So they have a high fever, they have the headache, they've started having the nausea and vomiting, they come to the ER. The triage nurse is going to ask them, have you been out of the country? Have you traveled? Where have you traveled? And if they say they've been in Sierra Leone or Liberia, we're going to immediately start thinking that direction. And that's where they'll say, have you been around anyone ill? But they're going to immediately start using protective equipment.
Well, and of course, I mean, I'm sure most of the listeners are familiar with the story in Dallas where the guy goes to the ER and somehow slips through the screening system. Where I don't know if he was asked whether he'd been in a country that had been stricken with Ebola. If he was asked, they didn't act on it, and so you're saying that the preparations are in place. If someone starts showing these symptoms, they're asked if they've been in Sierra Leone or Liberia or one of the other countries.
Absolutely. They, I guess you could say we learned from the error in Dallas, and that could happen to anyone. And CDC and the Wyoming Department of Health has had numerous education pieces and provide us at all the facilities in Wyoming with the information to ask those questions. We have this little placard, if you will, a piece of paper by the triage nurse that says, always ask these questions,
Yeah. Well, and that's
preparation.
That's an important part of any kind of medical treatment. Is I mean, obviously the blood tests and screening for symptoms, but also asking the patient's background.
Absolutely.
Okay, and if you're just joining us, we're talking with Veronica Taylor from Campbell County Health and Della Amon from Campbell County Public Health. We're talking a little bit about Ebola. I'll leave the lines open. 682-1270. 682-1270 is the number. If you have any questions that I might not have thought of here, but since we're talking about the preparations that have been made, I mean, what other preparations have been made at the state and the local level for dealing with a possible Ebola outbreak?
I think one of the important things is, again, education, making sure that providers and nurses, healthcare workers are prepared. We have a checklist that we've went through to...
Okay.
We have a checklist that we've went through to make sure that we have everybody's aware of what needs to be done. One of the things is our lab. The state provided the lab the information of how to prepare for the blood work tests and how to send it to the state, and then again they send it to CDC. So there's a preparation that we have to do.
So there's contact with the various levels as well, with obviously with the county and the state and the CDC to make sure that you're always up to date on the latest precautions in place.
Yes, very much.
So, and now as far as the county side of it, as far as public health side, I mean, I imagine there's probably quite a bit of preparation being made there as well.
Right. The Wyoming Department of Health has set out what they call health alert news items to all the providers, medical providers, and that includes public health offices. We've been on telephone calls with Dr. Murphy, who's the head epidemiologist of the Wyoming Department of Health, and he would be the lead person on this information. And so everybody is up to date, and we also use the CDC website. That's usually what they're referring back to because it has the latest and best information. And anybody can get on cdc.gov and hit Ebola, and they can get all this information right there.
Okay, and now going back to the hospital side of the preparations. Obviously, a lot of the people that are contracting the virus are healthcare workers. I mean, the doctors, the nurses, the other healthcare providers are in direct contact with patients, and obviously you take all the precautions you can, but sometimes you can't avoid coming in contact with bodily fluids. I mean, I've had enough nurses in my family to know that. What precautions are being taken to protect the staff at the hospital?
We would use the same precautions that we use for any contagious disease. However, the CDC has, of course, talked to us about that it's contact. So that's the precautions we use. They're called barrier precautions. We use gowns, we use masks, we use face shields, we use leggings to cover the legs. So we primarily would make sure that all exposed skin is and definitely eyes and mouth are covered so that a splash of body fluid would not get onto our skin.
Well, and I've seen a lot of people buying these big, huge yellow suits with respirators, and all that's not possible. I mean, it's a very virulent disease, but it does have to come in direct contact with bodily fluids. So as long as you have some kind of barrier in place, you don't really need a big, huge moon suit.
A moon suit, yeah. Right. Absolutely. We, Della and I were just discussing this morning, that we believe that as long as we use the proper PPE that we have available, that our healthcare workers will be protected. We do have, at Gillette, Campbell County, we do have something called PAPRs, and those are respirators that staff can choose to use. They use that, or they use the N95 respirator masks. So we do have two different kind of masks that they can wear. Now,
are respirators generally used for airborne illnesses? I mean, I imagine the first line of defense against something like Ebola would be one of those plastic shields that would go in front of your face?
Actually, the shields are more important, if you will, than the respirator itself, because the respirator is normally used for airborne. And they're really saying, the CDC is saying that Ebola is not an airborne disease. Now, if you were sitting next to someone and they had Ebola and it's in their sputum and they sneezed or coughed all over you and you're right next to them and it got on your face, that would be an exposure. Right. But generally, it's not in the air in the room that you're walking in.
Okay, and I think we might have a question here, so let's go to the phones. News Talk 1270, you're on the air.
Hey, Don, this is Ron. I'm curious because I think we're getting contradicting information here. I know you said, and they're saying it has to be contact with bodily fluid. You said that you made a point that it'd be hard not to have contact with bodily fluid. I don't know how you can justify that. How it would be hard not to. I mean, and yet we're wearing respirators and all this other stuff. I think the CDC is lying about how we can get it, and otherwise they wouldn't be talking all these respirators and all these face masks and all this stuff. I think they're trying to keep a real outbreak from happening. I heard on the news a while ago, and you probably did too, how there's a deputy sheriff in Dallas that they're watching real close that they think probably are showing some signs. I'm thinking that he didn't have contact with bodily fluids, and other people that have had contact with this fellow in Dallas, they can't all have had contact with bodily fluids. I think we're getting some contradiction here. I'm confused.
And thanks for the call. I just want to point out that I was talking that it's hard for healthcare professionals to avoid contact with bodily fluids. I mean, nurses and CNAs and doctors. I mean, you, as much as you try, it's almost impossible to not get any contact. Well, I guess there's, and I guess one of the questions is, I mean, viruses do mutate. I mean, if and again, this is something that you can correct me if I'm wrong, but is it possible? Is it possible that the Ebola virus might have been able to mutate? And if it did, how long would it take us to figure that out?
That's beyond my level of information.
Yeah, that's
something I couldn't even speculate on.
No. We have to go by the evidence that we're given by the experts. That way we are consistent in how we care for the patients and how we protect the staff. And we have to go by what the CDC is giving us and the Department of Health.
Okay, so I guess, and we're almost out of time here, but I just wanted to kind of wrap things up. I mean, the important thing I think to get out of this is I mean, it's all right to be worried about this, but I think Ebola, and again, you can correct me if I'm wrong, but it seems like it's a disease that can be avoided with good sanitation practices and being able to spot somebody that might have symptoms and make sure that they get help. Is that a correct assumption to make?
That's what we hope, that people who come in contact with it and can recognize that they're ill and get into care right away, and that will decrease the spread to anybody else, because we will know whether they do or don't have the illness. And I would like to put in a plug for a respiratory illness is the flu, and flu season is starting, and you can help protect yourself by getting a vaccination, and we are offering them at the public health office 8 to 12, 1 to 4:30, Monday through Friday.
And the flu will, and you can put money on this, the flu will kill a lot more people than Ebola this year.
It does.
Yes.
I've had my own experiences with the flu. I mean, everybody does need to get out and get their flu shot. Which actually brings me to another question before we wrap up. Is there a vaccination, or is there a vaccination in the works for Ebola?
They are working on one. It's not fully developed yet, but it is. They are working on it.
And again, it's not like the movies where it can be done in a matter of days. I mean, this is going to be something that's going to take a while.
There is no vaccine at this time. Just like there's really no medication to cure it or help you. It is symptom management only for care of a patient with Ebola.
So, and of course the guy in Dallas, I mean, he shows up and they start treating him. They're basically only able to treat the fever and the hemorrhaging and the dehydration and just hope that his immune system fights it off before the symptoms get him.
Right.
So I guess the bottom line is, don't panic.
Definitely.
Okay. Well, and of course, I want to thank again Veronica Taylor from Campbell County Health, and of course Della Amon from Campbell County Public Health. If we have any more developments here, I don't foresee anything in Wyoming, but you never know. If we have any developments here, of course, we'll have you in again. And I want to thank you for taking the time to come and tell us a little bit about it.
Thank you.
Thank you.
Thank you. And with that, we're going to take a break. We'll be right back. News Talk 1270 KIML.
Enough of the politics. Let's talk football. Don Carpenter on News Talk 1270 KIML. 70 K.